Good morning, everyone. I'm Montgomery County Council President Gabe Albornoz and Chair of our Health and Human Services Committee. I'm joined by my colleagues, Council Vice President Glass, as well as Councilmember Rice. And this is part two of what we've all commented on publicly as one of our favorite days here on the Council, when we get to hear from our boards, commissions, and committees regarding their important work and their priorities. And what always strikes all three of us is the interconnectivity between the issues facing all of the respective organizations, but also your remarkable dedication and the thoughtful approach by which we as a community tackle some of the most pressing challenges of today. So with that, what we're going to do is hear from three organizations at a time. Each organization will have approximately 5 minutes to provide their testimony, and after all three presentations are complete, my colleagues and I will then ask questions of all three organizations. We do it this way to make sure nobody is shortchanged on time, but also to keep things moving because we have so many amazing boards, commissions, and committees. And I once again want to thank Ms. Yao for not just putting together this packet, but for coordination of today's work, and more importantly, her work all year round of making sure these organizations and the ideas and the concepts and the policies that are discussed are followed through on. So the first three organizations we will be hearing from today is we will start with our Victim Services Advisory Board, our Montgomery Cares Advisory Board, and our Mental Health Advisory Committee. So I believe the representative for Victim Services Advisory Board is here in person. So Brian, please, if you could come forward. Anywhere you'd like. Come on down. And then after your testimony, if you could just stay there after the other two presentations and we'll ask questions. So the mic button is right by the mic. There you go.
Good morning, council members. Thank you for having me here today. My name is Brian Kusit. I'm co-chair of the Victim Services Advisory Board, and we advocate on behalf of victims in the county. I submitted previously the written testimony. I was prepared for 3 minutes, so 5 is a luxury. I won't go over everything, but I will briefly kind of highlight some of the things that our board is focused on in advocating on behalf of victims in our county. You know, the first thing I think, which won't come as a surprise to anyone on the council or anyone in the room today, is crime has increased in the county, just as it has done nationally since the start of the pandemic. So more crime equals more crime victims, which equals more need for victim services in the county. And just as one data point, which is in our testimony, HHS Trauma Services saw a 33% increase in service requests from fiscal year 21 to 22. Obviously, we're hoping that that stabilizes, but I think it underlines the need and increased demand for victim services in the county, which is why for the coming year, our board's #1 priority is ensuring that HHS Trauma Services is fully staffed to meet that increased need. And our testimony lays this out, but we believe that 4 additional therapist positions, 2 for each of VASAP and APP, would be a sufficient way of meeting this increased need in the county, and it would also allow the programs to create a dedicated intake unit, which we believe would make them operate much more efficiently overall. Our second priority is very straightforward. The Crime Victims Compensation Fund in the county was established in 1988 and set a cap of $2,500 per criminal incident, and that number hasn't changed since 1988. I think we all know prices have gone up a bit in the last few years. Certainly they have a lot since I was a little boy. So we would like to see that increased to $5,000. Which is basically doubling. I think that makes sense given the passage of time since the fund was established. And it would also help victims of crime who have, in the first instance after being traumatized as a victim, then oftentimes have significant expenses after the fact, whether that's lost wages because they can't work or medical bills in some instances, and obviously in the worst instances, funeral expenses for family members who are victims of homicide. So we believe that change would be appropriate. We had some great meetings with many of you and your colleagues on the council. Last year, we were heartened to see that council members Friedson and Jawando were supportive of that. So we would love to work with you to try to get that across the finish line in the coming year. And then finally, we continue to advocate for expanded transitional bridge housing for victims of intimate partner violence in the county. The Betty Ann Cranky Center is a tremendous resource, but oftentimes victims have to leave there after a fairly short period of time. And a longer period of time that would allow victims to become self-sufficient, and we believe would make it much more likely that they can move on with their lives separate and apart from their abusers rather than returning to them. Our testimony outlines a number of ways to do that, not all of which require the outlay of county funds. Some of them are just kind of altering the way that the county provides housing vouchers, and also kind of putting more of an emphasis on training service providers in the county to apply and qualify for continuum of care and other grants that are available from HUD and other agencies within the federal government. So with that, I'm happy to answer any questions. My board liaison, Rafia Prince, is here, so I can defer to her if you guys ask me anything that I can't handle. And otherwise, thank you for the opportunity to present today, and we're hopeful to work with you on these important issues over the coming year.
Thank you very much for that testimony. And I just got a note from Dr. Bridgers that Mr. Swan doesn't have the link for the presentation this morning. So if you could forward that to him, Ms. Yao. And so why don't we instead go next to our Mental Health Advisory Committee. Ms. Helga Luest is representing the Mental Health Advisory Committee this morning, and she is testifying virtually.
Good morning, everyone, and thank you very much for the opportunity to share some of the work that we've been doing and our recommendations for budget priorities going forward. Our first budget priority for you all to consider is expanding the child, adolescent, and adult mental health outpatient clinics. The Child and Adolescent Clinic in 2021 saw a 15% increase in referrals and also presentation of mental health conditions were more severe. The recommendation is to add 2 licensed therapists to the Child and Adolescent Clinic, as well as 1 licensed therapist for the adult clinic and 1 peer recovery specialist for the adult clinic. And that at least 1 counselor in each of the 2 clinics should be bilingual. The estimated cost for the request is approximately $400,000. And then our second priority here is for Montgomery County Police to expand the crisis intervention team unit. Currently, there are only 3 officers that are part of the CIT unit, and yet many of the calls that our law enforcement are responding to individuals with mental health, substance use, or Alzheimer's conditions. And so this would enable the CIT unit to go out and de-escalate and hopefully get those individuals into more supportive service. We also have a number of other priority areas that I just wanted to mention briefly. One is to leverage Medicaid for mental health services in schools and communities. Recently, the Center for Medicaid and Medicare Services issued some guidance saying that we can go beyond students with IEPs to provide or to use Medicaid funds for services in schools. So that would be no money, but would bring added money and service to our schools. Second priority item is for the expansion of the behavioral health workforce pipeline. We know that there's increasing demand for mental health services and much more demand than our service providers can offer at this point. Next, we have the promotion and support of the mobile response stabilization services. We continue to have a subcommittee on the environmental impacts on mental health and resilience, and are working with DEP and HHS to really try and more closely coordinate. So we would encourage the County Council to also consider mental health discussions in climate action planning and related funding. And then finally, we also still remain focused on suicide prevention, which continues to be a substantial concern in the county.
Thank you very much for that testimony. Took a lot of notes there. Mr. Swan, were you able to join us? Not yet? Okay. Then why don't we move on to our our Board of Social Services, Marquette Rogers, I believe, is joining us virtually.
Thank you, Councilman. Good morning, everyone. My name is Marquette Rogers. I am the chair of the Montgomery County Board of Social Services, which provides advisory oversight to the social services program within Montgomery County. We are funded by the Maryland Department of Human Services. These programs include state-funded income support programs, emergency stabilization programs, state-mandated child protective services, foster care, state-mandated adult protective services, and home care services. I am delighted to be in front of you to discuss the priorities that the Board of Social Services has set forth for 2021, as far as 2022 calendar year. As Board of Social Services, our responsibility is to ensure that the individuals in our community who have the greatest challenges and least resources receive the support they need as we move forward from the height of the COVID pandemic. Many are still facing extensive economic and social inequalities, both across our country and right here in Montgomery County. During the first half of 2022, the Board of Social Services focused primarily on establishing and expanding our collaborative efforts with other boards, commissions, and committees, while also partnering with program area experts from child welfare services to identify additional areas where the board can best support their efforts within the community and with HHS. Prior to the summer break, we had 3 vacancies for which we were actively recruiting, and then during the summer break, we lost 3 additional board members. So we were at a deficit. With the open recruitment, we were able to fill 3 vacancies out of the 6 ones that we had. With the new members joining us as we return from the summer break, we were hoping to fill the remaining vacancies. On to our priorities, however. Our priorities are focused on increasing opportunities for transitioning foster youth. Transitioning youth aging out of foster care continue to face a disproportionate level of barriers as they begin to live independently in the community. Creating opportunities for employment remains vital to the ability of these youths to not only meet their immediate needs, but also create financial stability in order for them to pursue their dreams. The second priority here is continued prioritization and support for the greater trauma-informed education. For the last 2 years, the board has made this a priority with the knowledge that trauma-informed practice is central to social services. This practice continues to be fundamental to social services, a need that continues to be magnified in our post-COVID-19 economy. As it has in the past, the board will continue to work on this priority and will continue to enhance and expand trauma-informed education to community partners. Our advocacy, third priority, the board will monitor federal, state, and county legislative changes that may impact services being delivered through our adult services, child welfare, and family investment. Working with each area and the community, the board will identify barriers to service delivery throughout the county. As legislative changes and barriers are identified, we will partner with HHS and its experts to determine how best to advocate for the individuals and families being served. So, on behalf of the Board of Social Services, I would like to express how grateful we are for the ongoing work and support of the Council, which has made significant positive impacts on the lives of our most vulnerable residents. It is with your help that the human service programs available in the county have gone beyond meeting the basic needs of residents and extend into the supporting self-sufficiency in order to create a better future for all. Thank you for your commitment to continue to serve all residents of the county while making those individuals in our community who have the greatest challenges a priority to receive the support they need to be successful. The board greatly appreciates the partnership that we have with all the members of this esteemed committee. I thank you for your time.
Thank you very much, Mr. Rogers. Three great presentations to kick us off this morning. So I'll start with some questions, comments, and then defer to my colleagues. So Mr. Kusid, yes, I totally support, I wouldn't be surprised if all of my colleagues do, ensuring that we enhance the Crimes Victims Fund. And you had brought this to our attention last year as well, and it is something that we're going to need to focus on in the next budget year, particularly with the rise in crime. And that can help with the transition for families who have been victimized, but both the victims themselves, but by extension, their extended families, their children, et cetera. So I think it makes sense for us to move in that direction, reflecting the reality of what's happening on the ground right now. And with regards to our Mental Health Advisory Board, I want to thank you very much. That continues to be an not under overlying theme among all the various respective issues that we've heard on this committee. It's impacting generations, it's impacting every zip code, it's impacting everyone in ways that are very profound. I did have a question with regards to preventative care. I know there has been some discussion. We clearly need to step up our game in providing mental health professionals at all levels to especially our most vulnerable populations, particularly our children and youth. But has there been some discussion or some strategy? I know MCPS has been very focused on this, and I know other organizations have as well, but I'm just curious as to if you all have started thinking about some best practices and what are some other areas we may want to consider investing in.
I think, Mr. Rogers mentioned something that is a common theme for the Mental Health Advisory Committee, which is trauma-informed care, and really thinking about, how the nature and impact of trauma can affect someone across their lifespan, and also how their worldview and how they heal and how resilient they are. The committee has been really focused on the environmental impacts of on mental health and resilience as a preventive measure. So our work there was really to try to coordinate between emergency preparedness, environmental protection, and HHS, and kind of streamline things so that we're thinking about in our programming how to build resilience. And so much of that stems from a little bit of intention to build community connectedness. So in a time of emergency or a severe weather event, our neighbors become our first responders. And the more we can do to promote those healthy linkages and friendships and really building a stronger sense of community, the better people will be in a time of crisis, whether it's something outside our control or if life just throws a curveball. Those relationships, are essential for good mental health and resilience. So that's pretty much where our focus has been in the past year or so.
I love that. So now that in such a positive way, it feels like so many events and whatnot have come back, those time and places for us to gather as community are more important than ever. And so I think that was a really good suggestion. I like that a lot. And then Mr. Rogers, with regards to our Board of Social Services, thank you so much for your transition in trying to find new members and continuing your critically important work. And I think Ms. Lest really hit it on the head with your comments regarding trauma-informed practices really resonate in so many different areas. And I know our good friend Luis Cardona from the Street Outreach Network has been working aggressively in providing trauma-informed practices for the young people that the Street Outreach Network works with, who are, because of the rise in crime and some of the other issues that we're seeing, are being subject to emotional challenges that we haven't seen before. So I appreciate all of your efforts. I'll now yield to colleagues to make any comments. Council Vice President Glass.
Thank you, Mr. President. Good morning, everybody. Thank you for joining us today. And I'll just tick through the three organizations and make some comments or questions. And Mr. Kuset, I appreciate your redoubling and recommitment to the efforts that might not have gotten the funding in the last year or two, recognizing how much trauma families and victims experienced during a time when we were all stuck at home and they were stuck with family members who did not treat them very well. And that pain and that trauma continues. And so that is why your organization and the Benny Ann Kroenke Shelter is just so critically important. And a question I have for you, while I visited, I've been there twice during this term, from what you're hearing, what is happening to victims when they are asked to leave the shelter because there's no more space for them, or that they do go on somewhere else thinking that they are safe? Can you share a story or two that might have come your way?
I will do my best to do so. Obviously, Dr. Prince here is
Sure.
much more on the ground. But in our meetings, we've discussed a number of instances where victims of intimate partner violence are at the shelter for some period of time, then forced to leave simply because they don't have the capacity to keep people for over a certain period of time. And there's a variety of kind of next steps. You know, in some instances, the individuals are able to qualify for housing vouchers or other assistance that enables them to go to another safe place. I know that in some instances we've even used motels and hotel rooms on a short-term basis for that. Unfortunately, there are some instances where victims don't have another option and end up going to back to their abusers. And I know in years past there had been some efforts to create a spot right over here on Fleet Street for victims in that situation. Unfortunately, that house that was set up for that was discovered to have lead, which made it unsuitable, especially for women who were trying to leave an abusive situation and had young children. And that full need has not yet been met, which is why we continue to advocate for it. So I think that the need is still there, and obviously there's different ways of attacking it. What we've tried to do as a board is kind of look at that holistically, both what the county itself directly can do and also how the county can make use of and take advantage of available resources from the federal government, or even, and this is in our testimony, there is a vulnerability index that's used for determining housing vouchers in the county. And currently, victims of intimate partner violence are given a 1-point priority for that. You know, an additional thumb on the scale for people who are trying to escape an abusive situation, maybe 2 points, 3 points, would, you know, enable them, give them a better chance of getting housing assistance without necessarily requiring additional outlays from the county. So, you know, we're willing to address this any way we can to try to help as many people as possible.
And the beautiful part of these conversations, and I noted this yesterday, is having all the different leaders hear the other work and the other priorities and where there are similarities and there's overlap. And what you were just alluding to is part of the continuum of care in which the Interagency Commission on Homelessness is trying to prioritize families who might be experiencing homelessness, which in the reality is women with children, and many of whom are experiencing the situations that you're trying to solve. Right, and so there might be future conversations, and would maybe encourage intercommission dialogue in that respect, to see what can be done with some of those vouchers, and can see how you can help with some of their priorities. But let's continue that conversation. Appreciate your thoughts, and look forward to some of those collaborations.
Thank you.
Switching over to the Mental Health Advisory Board, Helga, good to see you this morning. I also appreciate the emphasis on therapy and bilingual communication, and the spelling out how much that would cost. That's always helpful. It sets the bar, but it's one that we have to meet. And one of the things that we have not been able to do over the last year or two is meet some of the obligations that we've already set forth, specifically with the crisis intervention. And I think you alluded to this, that we need more of it. And as this committee has been working with some of our downtown areas and regional services centers, recognizing that when there is a crisis outside on the street, that the police department might not be the first call one should make, that there are other ways to intervene. And so we had put forward funding that was appropriated for crisis intervention, and unfortunately there is a shortage of mental health specialists. And so we are already trying to backfill and hire for positions we've already appropriated. And we need to continue doing more, but just wanted to share with you, if you weren't aware of what some of those troubles are, because that's quite frankly what it is. It's a troubling situation already, and the fact that there are not enough professionals to hire makes it even more troubling. But we are working with the department, with others, to try and hire those, backfill those, but clearly we need to do more, and look forward to working with you to fill out the roster. And hopefully we get some more teammates coming out of universities who want to come to our area and help do this work. And I know you're plugged into some of the university systems. Are there any conversations there about getting more graduates in these areas?
We have not done outreach to universities in the area, but that is something we can definitely explore in the year ahead. With regard to the CIT unit, so our recommendation was did not include a budget, a line item for the budget, an increase in budget for CIT, largely because in the committee's work we found that there were a number of law enforcement officers that had CIT training but were not part of the CIT unit. And so this could be maybe just a transfer of assignment and bringing more people into the CIT area rather than finding additional staff. So that's just a consideration. Given the large volume of calls that are related to mental health, substance use, and other conditions like that, it would be, I think, a great opportunity for us to focus on de-escalation rather than making steps forward and people become just as involved and it becomes a downward spiral.
I agree 100%, and appreciate that information about some of the members of our police force. And so it might be, or it is worth a conversation to see how their training, their specialized training, could be put to use. So thank you for sharing that. And then Mr. Rogers, I know you're virtual, but I just have to tell you that when you were providing your testimony, there was a lot of head nodding in this room, because everything that you highlighted clearly is important to the other two panelists that we're speaking with and to everybody else in this room. And so I just want to say thank you. And again, in the spirit of collaboration, I think it would benefit everybody to reach out to some of these other organizations, and I'm looking to staff as well to see if you can foster a joint meeting so that there can be more brainstorming and more partnerships to achieve a goal or achieve goals that we all want to work towards. So Mr. Rogers, thank you for being here and for your leadership as well.
Thank you, sir.
Thank you. Councilmember Rice.
Well, thank you very much, Mr. President, and thanks to the three of you. Some may know, but I actually, before coming into elected office, served on the Victim Services Advisory Board. It was my first role, and it's because my family, unfortunately, experienced a very significant tragedy. So I do understand wholeheartedly about the need to increase the funding. It matters significantly when you think about the trauma that continues throughout a person's lifetime. It's not just about that year or 5 years that it takes. And so from that perspective, that's a drop in the bucket. when it comes to really addressing the impact that it has on the families as a whole. And I appreciate both the Council President and Vice President acknowledging that this is something that affects the entire family, not just the one individual who may be the victim of a crime or is lost due to crime. And we've seen so much of that, especially in my district, in Germantown, to where we've seen a significant rise in IPVs. And so it really is important for us to continue working with our police department, working with our Department of Health and Human Services to, as the Council President was talking about, focus on prevention on so many levels. There are indicators and markers that are out there that our police have been able to identify, folks that are working in our communities have been able to identify in terms of those red flags. And we really need to start following up on those and trying to do as much intervention as possible to ensure that we're not going down that road. So I really appreciate what you've highlighted here. I think it's incredibly important for us. The same thing applies to our children in schools. And some of the challenges that we've seen there with the rise in violence in our schools. You know, it's one of those where, again, those are also, and it's very interesting how, and that's why I love serving on the Victim Services Advisory Board, because it's so interesting to just talk to folks and how folks minimize an impact like the fight that happened at Northwest and say, well, it's just a fight. Well, the reality is it has huge implications and ripple effects that continue on, but that person, whoever was struck, whatever the case may be, suffers also. And people don't really think about it from that perspective, but the torment, because I've seen it, because my daughter goes to Northwest on social media, where people then latch in on that person and say, oh, you're the one that got beat up, you're so the continued victimization, those kinds of things also are incredibly important. So again, I think you guys are doing great work. You've always done great work since I was there, and so I know that it will continue. I really think that that's important, and again, echo the same sentiments about housing. We've got to make sure that we continue to do more to make sure that especially majority women who are with children, who are victims, need to be protected, and we need to find ways to ensure that they have safe housing. I did want to talk to Helga, because I know in my conversations, and I just was on a conference call with the White House yesterday about this, that I know that there's now new funding that's come out to expand for our certified community behavioral health clinics that the Biden administration has just put out. And so I think it will be really important for us to make sure that we're leveraging that and applying for that additional grant money that I think is going to really be a critical step in helping to really increase the availability of our evidence-based community mental health services. And so I just really think that that's important. I will say that I'm very concerned about our kids. As you are, and you've highlighted that, but it's really important for us, and I think that Councilmember Navarro's work when it came to fighting for the health and wellness centers inside each of our high schools are going to be instrumental in terms of being able to then leverage to do what you're talking about, because I think that, again, when we're talking about having the drawdown from Medicaid for those individuals, the reality is that there are other eligibilities that are out there also, even outside of the IEP realm and what you've referenced, that will be able to, again, through some of the work that the Biden administration has done, to be able to make sure that we can draw down some mental health supports for our kids in our schools. So wanted to just echo on that. And then Mr. Rogers, it's so good to see you as always. It's a pleasure being on the board of social services. Unfortunately, I'm rotating off, so I know all too well about the priorities. I get all of the updates. Unfortunately, I haven't been able to attend as many meetings during COVID, but certainly appreciate all of the great work. It's very interesting because the Board of Social Services to me is an overarching umbrella of so many of these other issues that we have that are out there. I do believe that your role in terms of being able to help to coordinate and shepherd, as we heard from the Council Vice President, is going to be incredibly important, especially as we have newer members that are coming onto the Council as well, and informing them of the great work that's being done by community organizations, but also when it comes to our constituents. We continue to grow as a county, and so one of the biggest challenges that I see, and this is actually for everybody who's in this room, is that people don't know about the services that are available to them. and so therefore aren't able. And so I think that one of the things that the Board of Social Services should certainly take up is sort of really concerted effort around informing people of what is out there, because we individually do, you know, our own work in our own spaces, but having that coordinated effort to be able to have a marketing campaign about these are the services that Montgomery County provides if you need them are just incredibly important. And especially, like I said again, as we have our immigrant community that continues to increase, as well as folks, newcomers that are coming into our region, it's going to be incredibly important for us to just educate our community. And for so many who never needed the services before, who are just now, and we saw this with COVID, realizing, hey, I need this additional help, they're not sure where to turn. And so from that perspective, it'll be really important. And I see Helga has her hand up.
Thank you. I just wanted to comment on what you were just talking about, and making sure that residents are well informed of what supports are available to them. So one of the things that we've been talking with emergency preparedness about is using the alert system as a way to include messages of, like, if there is a severe weather event, and if you are experiencing psychological distress, to provide that, you know, that number, whether it's 988 or some other resources, that those, you know, it just takes a little bit of effort to include that information. Also, you know, using services like Nextdoor, where you can get down to the zip code. So if there's something that's happening in a particular neighborhood and people might be in distress about it or concerned about their safety, giving them, you know, using these alert systems as a way to get that information out. It's kind of meeting them where they are already, whether they're getting the push notifications on their phone or getting the emails through their community boards on Nextdoor. But I think that, you know, this is sort of a no-cost way of really integrating some of our supports and using those channels of outreach as a way to really plug people into the support they might need.
Okay, thank you. I can't agree with you more. I think it's an awesome idea. And so I turned to Ms. Yao and said, we need to do that. So hopefully my colleagues who are coming back will certainly make sure that that happens. I think that's terrific. And even having it rotating to where every organization has an opportunity to push out their message with the alert system, just to say, hey, did you know? These are things that we provide if you're experiencing X, from homelessness to domestic violence to mental health to, you know, everything under the sun. If you're a victim of a crime, I mean, everything that's there, we can push out. And so I think that's a great idea. So thank you very much. And thank you. Back to you, Mr. President.
Thank you. Well, thank you to all three of our panelists. That was an excellent start to our morning. Next, we are going to hear from our Montgomery Cares Advisory Board, followed by the Latino Health Initiative, and then the Interagency Commission on Homelessness. And we will start with our Montgomery Cares Advisory Board, and I believe Mr. Swan has joined us virtually. And you have 5 minutes, sir, to provide your testimony. And Mr. Swan, we're going to hear from all three presentations, and then turn off your camera, but stick around, because we're going to ask questions after all three panels. You're on.
Thank you. Good morning, President and Chairman Albanaz, council members, members of the public. My name is Wayne Swan. I'm the chair of the Montgomery Cares Advisory Board. The advisory board, just by reference, provides guidance to the county executive and county council, which financially and operationally support the healthcare safety net for uninsured, low-income residents of Montgomery County. The MCAB is focused on ensuring that with the support of our essential partners, including the Primary Care Coalition, the area hospitals, the County Department of Health and Human Services, and the exceptional capabilities of the clinics themselves, the provider network is strong, costs are minimized, and efforts are taken to acquire new resources to ensure that county residents in need receive high-quality primary care services. We were asked to provide two priorities, and so we've identified priorities for all of the programs under the category of healthcare for uninsured. But the two primary goals that we've like to identify for FY23. We will continue working with the Department of Health and Human Services to design and implement an eligibility policy and a process that will become the key for the Montgomery Cares transition to value-based care in phase 1 of empanelment. Montgomery Cares Advisory Board and our partners will support the reimbursement work group in collaboration with the Department of Health and Human Services to agree on a plan to reasonably align Montgomery Cares administrative and policy regulations and the quality of care standards with similarly regionally situated healthcare centers in Maryland and Medicaid. We also agree upon a phased-in reimbursement rate for primary care services starting in FY25 that is also on par with these similarly situated organizations. The second overarching priority is that we intend to use a dental collaborative facilitator to plan and guide the scope of work to include the implementation of value-based care into the delivery of dental services across the county, emphasizing an integrated medical and dental preventative approach to improving patient overall health, and develop a collaborative dental network design that will complement the proposed health and legislative Maryland medical assistance bill, which will provide dental coverage for low-income adults throughout the state. Montgomery Cares Advisory Board plans to implement these priorities with the mindset toward prevention by using culturally sensitive interventions and strategies delivered within an array of settings. We can introduce messages and programs aimed at preventing or delaying access to care. Further, with the continued strong support of our partners and the council, we can have an even greater impact on more county residents in greatest need. Going forward, we again thank the council and the county executive for the support that has been provided to Montgomery Cares Advisory Board and our direct provision of care to our clients that are in most need. And the uniqueness of this safety net needs to be touted and raised up, and congratulations for all those that are part of this process. That since as we go forward, we will continue to expect a similar level of support. And again, thank you, each one of you, particularly the council and county executive and Chairman Albanaz, for your dedication and support to these principles and upholding the safety net through this pandemic. And with that, I'll close my comments and respond to questions.
Thank you so much, Mr. Swan. Next, we will hear from our friends in the Latino Health Initiative, and Ms. Patricia Rios will be speaking on their behalf and doing so virtually. Ms. Rios, you have about 5 minutes.
Good morning, council members Alvarado, Glass, and Rice. I am excited to join you this morning. My name is Patricia Rios, and I have the pleasure to represent the Latino Health Steering Committee of Montgomery County. As an independent group of volunteer professionals and community leaders who advocate for activities and policies that promote and enhance the well-being of Montgomery County Latinos, the Latino Health Steering Committee, or LHSC, would like to present priorities focused on access, engagement, and prevention. The two priorities I will mention reflect our shared commitment to improving the health and well-being of Latinos across the county and are echoed in the latest iteration of the Blueprint for Latino Health in Montgomery County. First, we would like to advocate for policies that increase and improve access to healthcare, addressing both basic and urgent health needs. The pandemic has had a devastating impact on the health, wellness, and economic well-being of county Latinos, and this continues to be felt in acute ways. Latinos across the county are encountering significant challenges in accessing basic services such as food resources, physical and mental health services. Every day, we meet Latinos at clinics and community events who are very ill and who tell us about their healthcare challenges. We attempt to connect our clients to other programs and services to meet their needs, but we often hear of barriers associated with long wait times, transportation, affordability, and lack of cultural and linguistically providers. We recognize Montgomery County's timely action to allocate resources to respond to the immense human needs seen during the pandemic. We are especially grateful for the funds allocated to the Por Nuestra Salud y Bienestar initiative that successfully delivered life-saving COVID-19 prevention, education, testing, vaccination, and support services to county Latinos. However, these human needs remain, and in many cases are more pervasive than before. For those people who continue to struggle to feed their families, access health and mental health care services, and find and pay for affordable housing, this is a crisis. And it's also a crisis for a healthcare delivery network that struggles to provide timely and quality services to patients in need. So we request that proper funding be allocated to expand the capacity of health and social service programs to provide timely care for the sick, and especially funding to increase the number of bilingual mental health providers to meet this urgent community need. Second, we would like to advocate for an increase in community engagement efforts to drive prevention and positive health outcomes. The unquestionable success of Por Nuestra Salud y Bienestar work demonstrates the importance of community engagement as a mechanism to drive positive health outcomes. Building community trust is a key factor in achieving meaningful community engagement. The Por Nuestra Salud y Bienestar initiative builds trust with county residents by redefining how county government can serve, by being responsive to the community's needs, and by bringing high-quality service directly to those who need them the most. Delivering these services over the past 2 years on a regular and recurrent basis in Spanish build trust and ensure an unprecedented level of community engagement with county programs and services. We know that county residents who are actively engaged and informed on health and social services practice prevention, and as a result have better health outcomes and have a higher quality of life and can make greater contributions to their community and the county overall. Maintaining the progress made in increasing access to health and social services during the pandemic requires ongoing investment. Therefore, we respectfully request that funding is prioritized to reinforce health prevention programs and services, including a wide breadth of testing and early detection screening services, as well as the deep community outreach and engagement strategies that keep residents informed and reduce risk for chronic diseases and other comorbidities. Comprehensive prevention efforts for the most vulnerable among us must address all the social determinants of health, including economic stability, education access, as well as housing challenges. So access, engagement, and prevention are not just our priorities for FY23, but are also indicators of equity that we must strive to achieve. The Latino Health Steering Committee and I thank you for the opportunity to present our policy priorities for fiscal year 2023.
Thank you very much, Ms. Rios, and stick around. I've got some questions for you and some follow-up, but we have one more presentation for this panel, and that is from the Interagency Commission on Homelessness, and Jeff Goldman will be speaking on their behalf.
Great, thank you. Good morning. I'm Jeff Goldman from the Interagency Commission on Homelessness. It's a pleasure to have the opportunity to meet with you this morning and collaborate, and also hear from all these other great organizations that are all doing great work on behalf of folks in Montgomery County. As we move beyond, as many people begin to move beyond the impacts of the pandemic, the homeless continuum of care continues to be severely impacted by COVID-19 and its economic effects. The pandemic has only exacerbated the long-standing struggles of people experiencing homelessness and furthered the racial disparities in housing, eviction rates, and health outcomes. We must continue developing strategies to reach out to households at greater risk of eviction and imminent homelessness, including those with few or no assets or savings, smaller support networks, and lower labor force attachment. These are generally households that struggled before the pandemic and have the fewest options to pay down mounting debt, struggle to maintain housing, and are the most likely to become homeless. The Continuum of Care and the Interagency Commission on Homelessness, the ICH, have added several new programs for housing resources addressing the immediate crisis, keeping people in their homes and rapidly connecting those without homes to permanent housing. In the last 2 years, we have housed over 1,000 individuals and 236 families, but 1,214 individuals and 284 families entered homelessness. This is a net gain of 253 households, individuals and families combined. More resources are needed to ensure continued stability for those in housing and respond to the growing number of people entering homelessness for the first time. The ICH, and we've submitted a letter. I will only highlight a few of the priorities here. We do encourage you to read through the rest of it. And they fall into the categories of long-term housing subsidies, removing barriers to sustaining housing, and development of deeply affordable permanent housing. So in the area of long-term housing subsidies, the Housing Opportunities Commission, as the largest public housing authority, is a critical partner in our efforts to end homelessness. In communities with greater success in reducing homelessness, they've established coordination with the Public Housing Authority and the COC to ensure housing vouchers go to those with the greatest need. Examples of this great partnership can be the issuing of 118 emergency housing vouchers during the pandemic. And the ICH has great appreciation for the work that HOC did to support getting those vouchers out and supporting people experiencing homelessness. We do ask for more advocacy, though, for homeless preference from the Housing Opportunities Commission to ensure that households experiencing homelessness are prioritized for federal housing choice vouchers. We also ask that you advocate for the Housing Opportunities Commission fills vacancies from the rent supplement program of the Homeless Coordinated Entry System. We also ask that you advocate for increase in the Housing Initiative Fund to meet the growing need for housing for households exiting or with a history of homelessness. Dedicate at least 10% of all newly produced or preserved affordable housing units to households exiting or with a history of homelessness. In the area of reducing barriers, it's getting harder and harder to house people even with housing vouchers. Just having a housing voucher does not guarantee that you will be able to access housing. Housing discrimination, whether intentional or not, occurs regularly. In general, Maryland is a landlord-friendly state, and the ICH asked the council to advocate for tenant protections. And a few of these that we'll mention again, there's a few more in the letter. Support just cause eviction legislation at the state level. We want to see the development of an independent pathway to investigate housing discrimination and illegal practices at housing complexes that are not client-driven. We ask that you provide additional resources to the Office of Human Rights to expand testing for housing discrimination. In the area of development for deeply affordable permanent housing, we need more housing, and housing where rent is not more than $500 a month, particularly for individuals, including seniors on a fixed income. We ask that you utilize $7 million allocated to the county through the HOME program, in addition to the Housing Initiative Fund dollars to purchase and renovate a facility for this purpose. That can include purchasing of a hotel or similar resource that could be purchased and converted to deeply affordable permanent housing options. With that, again, we've submitted a few other ideas in our letter. We greatly appreciate the opportunity to join you this morning and share this testimony, and look forward to discussion and further collaboration on these issues down the road. Thank you.
Thank you very much. Again, 3 wonderful presentations, chock full of really important information. So I'll start with our Montgomery Cares Advisory Board. Thank you again, Mr. Swan, for your leadership and that of the entire board. Wanted to talk to you about, we launched the Guaranteed Income Pilot earlier this year, which we're very, very excited about. A lot of credit goes to the Department of Health and Human Services for doing some heavy lifting and getting that initiative off the ground. I think it would be a good idea for many of the boards and commissions to track the success of that initiative and its progress, because it really connects nicely to a lot of the various initiatives that you all are talking about, and I think is going to be a game changer. There was a great article in the Washington Post about the Compton, California initiative that really sort of our program is modeled after in many ways, and so something to follow up on. And do appreciate your comments in this council and the county executive's efforts to strengthen our safety net. our Department of Health and Human Services received a record increase in its budget this year, in no small part because of the interest in strengthening that social safety net. So we appreciate your leadership. To my friends at the Latino Health Initiative, certainly amen to everything that you all suggested, and I want to double down on the community engagement efforts, because the manner in which we sort of flooded the zone through the pandemic by being at Home Depot, our parks, our grocery stores. I mean, we were everywhere, and through not just the health promotores, but through partnerships and alliances with faith-based organizations and many more. And that was what, more than anything else, I think, turned the tide to be able to get the correct information that's out there. We have to keep that going. And we were able to restore some of the funding with the Latino Health Initiative, for Por Nuestra Salud y Bienestar, to help ensure at least the call line, which has also been a tremendous success, sort of a one-stop shop for a number of residents to be able to access and find out about different programs and services. We have to keep doing that and identify professionals who are interested in expanding that work. So I think that will be very important moving forward. And I think that other, and this is true of all of our minority health initiatives and programs, one of the outstanding byproducts of your all's work is not just the policy recommendations you make, but each of you has done a really great job in identifying civic talent and getting them engaged in a very productive and tangible way that creates a new group of advocates who can not just advocate for public health, but other things as well. You mentioned housing, which is obviously deeply connected to each of these components. So really appreciate that. And you know, with the concept of early detection is also critically important and connects back to the communication strategies that we're going to need to utilize. So I know this, and I'm hoping and I'm sure the next council will be committed to continuing that work, but just wanted to share those thoughts with you. And then I want to publicly once again thank Council Vice President Glass and his team for doing such an outstanding job in their leadership role on behalf of the council on homeless and vulnerable populations. Council Vice President Glass has really taken that role very seriously and done an outstanding job, both as an advocate but also a bridge builder with different organizations within that sector. And I think the recommendations that have been laid out are very important. And while some of them may have a price tag, clearly we need to make these kinds of investments and keep that momentum going. So I also want to mention, as I wrap up before yielding to colleagues to make comments as well, really enjoyed a visit to Priscilla's house, which is managed by Interfaith Works just actually a couple weeks ago. And it's a facility that offers housing for women who have experienced homelessness, maybe the victims of domestic violence. It's an extraordinary facility, and the way it was renovated was through a public-private partnership with our private sector that helped underwrite the cost of the renovation. And I think we need to explore more opportunities like that and be more intentional in creating a time and space to connect our private sector to your all's great work. And I think that there's an opportunity for us to do even more of that moving forward. So appreciate the testimony from everyone here, and I'll now yield to colleagues. I'll start with Councilmember Rice this time.
Well, thank you very much, Mr. President, and I can't really say more than what you've said, but I did just want to highlight and thank Montgomery Cares. So when it comes to the dental collaborative facilitator plan, something that I've been very passionate about in terms of making sure that we have dental services, and rotating off of the council, I'm going to lean to my colleagues to carry that torch. It is incredibly important, especially for our communities of color and of lower socioeconomic status, and something that's oftentimes taken for granted, but something that is incredibly important to the overall physical health and, quite honestly, mental health. If anybody's ever experienced any kind of dental pain, knows all too well how difficult it is to then concentrate on anything. And so from that standpoint, kudos for highlighting that. I did want to talk with LHI because, again, you guys have done tremendous work in standing up. And, of course, as you heard from the Council President, we need to keep that momentum going. It is something where, look, we in this county had identified early on that there were gaps when it came to health for our communities of color. And because we did that pre-COVID, we were much better prepared and actually saved more lives because of that great work. And now is an opportunity for us to continue with that momentum to save even more lives and make sure that we're eliminating many of those equity gaps that exist when it comes to public health in our communities of color. So just really want to say thank you for all of your great work. And then just one idea for my interagency on homelessness, because I think that we talk about hotels often, but one of the things that are readily available right now are commercial buildings. And oftentimes commercial buildings are not situated for independent apartment space. However, it would be well suited for a pension style of living for individuals as a transitional housing, because you do have bathrooms that are located on each floor that can be modified, and then you'd have individual places where people could actually sleep and do things in a private manner, but then also then have a group area. They normally have like a group kitchen and things like that. And so it actually is a shared model that's worked well in the past. And so it's just something to look at because we have so many vacant office spaces that are out there right now. It's just another option for us to look at. So I think that in addition to everything that you said that I agree with, I think we need to add that to the mix when we're looking at creative and innovative ways to establish more space. So thank you to you all.
Thank you. Council Vice President Glass.
I echo everybody's sentiments, so I'll be brief. And I appreciate Councilmember Rice bringing up the dental services, something that we weren't able to carry over the goal line last year. But we worked through that with the advisory board and with the Primary Care Coalition and other advocates, and we'll take those lessons learned forward into this fiscal year, so hopefully we can get that done. So yes, legacy lives on. So I appreciate that, Councilmember Rice. Ms. Rios, thank you for your continued advocacy. The council president nailed it when he talked about the collaboration and the efforts that had been underway to get our Latino community become the most vaccinated population in Montgomery County and help make our community safer and healthier. And I'll share that just last weekend I partnered with a community clinic and was in the Long Branch area, and we provided about 100 shots, both COVID boosters and flu shots, for residents who were just going grocery shopping. And some of them needed a little cajoling and a little reminding that this was good and healthy and safe and for their betterment and the betterment of their family. But at the end of the day, we had 100 healthier people in our community. And so it's partnerships like that really make our community stronger. So thank you for all of those efforts. And Mr. Goldman, it has been a pleasure over the last 4 years really working with the ICH. It has been a pleasure working with my two colleagues here to fulfill and carry forward that mission of the ICH, and not only to do that here at the committee, but to do it at 1 o'clock in the morning and 2 o'clock in the morning, as I've been with both of them, and members of the commission and members of HHS, CEF, and our nonprofit partners when we've gone out to talk with people experiencing homelessness. And so we are partners in arms, and we're doing the hard work, continuing to carry out the mission that was set way before any of us joined the council, but the success speaks for itself. And that is due to your all advocacy and our remaining and continued commitment. And I know that we will continue those commitments. And your point also about there needing to be more affordable housing that is affordable, and also recognizing that just because more vouchers are provided, that does not necessarily translate into more housing opportunities, because there is a shortage of affordable housing. Noted, noted, noted. And, it is of topic this week in particular, housing. And I will say, the last thing I'll say on this point is if we want there to be more housing that is affordable, there needs to be more housing. And thank you for your continued advocacy on that part. And thank you all for your leadership. I appreciate you.
Thank you all very much. So we have 4 groups left. So why don't we do 2 at a time rather than all 4. So we have the Commission on Health, and we also have our Asian American Health Initiative represented by Dr. Nguyen. But we'll start with our Commission on Health and Crystal DeVance Wilson. Sure. And Ms. DeVance Wilson, welcome. You've got about 5 minutes. You need to hit the button right by your microphone.
Okay, got it. Good morning. My name is Dr. Crystal DeVance Wilson, and I first want to thank the Health and Human Services Committee for inviting us to take part in this discussion. I also would like to thank Dr. Bridges, Dr. Rogers, and our Public Health Services staff for their continued support of the Commission. We are very grateful. The Commission continues its commitment to addressing the public health concerns of all county residents, and as in past years, health equity and data modernization are core to our FY 2023 priorities, which are access to care, environmental health and education, and public health administration. Our advocacy in the area of access to health includes building capacity in the public health workforce and public health programs in order to enhance public health clinics, school health clinics, behavioral health services, and immunization efforts. We support increased funding to create new programming as well, and prioritize program services and resources which aim to resolve inequities in access to care. Our second priority is environmental health and education. Every day, we are exposed to environmental toxins through the air we breathe, through the water we drink, and the products that we use. The Commission is asking that the county explore opportunities through public health services and other DHHS departments to raise awareness about environmental health risk. The Commission is advocating for tactical and strategic discussions within government and community stakeholders. We also support planning and work between government departments, and we support the development of environmental health education, which then needs to be widely disseminated using multiple modes of communication. Our last priority is public health administration. The Commission believes the HHS and Public Health Services have worked really hard to address social determinants of health and could do so much more if it weren't for the persistent barriers created by limited human and financial resources, inability to fully monitor and evaluate programs, and the limited data capabilities. I beg your pardon. For these reasons, the Commission is advocating for developing data management systems to monitor, analyze, and evaluate current programming, improved sharing of information and data between departments and community stakeholders, and promoting synergistic and complementary relationships between sectors and departments, which we believe will result in an engaged, empowered workforce, innovation, and increased productivity. Thank you all for giving us this opportunity, and we appreciate your partnership with us in our efforts to create a healthier Montgomery County.
Thank you so much, Dr. DeVance Wilson. Dr. Nguyen.
Good morning, Council President Albanos, Council Vice President Glass, and Council Member Rice. So, my name is Nguyen, and I serve as a chairperson for the Asian American Health Initiative Steering Committee. So we are a group of community leaders to work to advise, assist, and advocate for Asian American Health Initiative. So today it's my pleasure to be here with you to share with you about the achievement of AHI in the past year, as well as the priorities of AHI in FY23. So we have two main priorities. The first one is to build the capacity for community-based organization, faith-based organization, and other NGOs that serve Asian American in the county. So why? The first is because Asian American is a diverse community in the county. We have 15 subgroups, and each of the subgroups have the diverse culture and language need. So in the past decades, we rely on a number of NGOs who provide that service, the critical service to the community, from the basic service like food assistance, language translation, to more complex service like counseling, therapy, as well as service navigation. So all that will depend on that network of organization to serve the community. And with that, all the great work that they do, the challenge that they feel is that they have relatively weak infrastructure because it's based on the volunteers and limited staff. So therefore, there's a dire need that we need to continue to help and support them. And the COVID pandemic have proved that we rely on this critical organization to build a bridge between the county and the community. They are a frontline and they work closely with the Department of Health and Human Services to provide the support to our community on screening, vaccination, as well as all the critical services for the community. Therefore, this bridge is critical. And I think I heard from Councilmember Glass earlier, how can we continue to build that support? How can we sustain the support for our community? Therefore, the investment in this organization cannot be less than a priority, so that we in the future, how can we build that trust? How can we maintain that bridge between the government and this community that we serve? Let me share with you the success, the impact of the investment of the council in the past year. So thank you for your support, because the COVID relief fund that allocated $1 million to support our Asian American community. And we use that fund to support this organization. And through that $1 million, we support 11 organizations. And through that work, more than 92,000 individuals was helped throughout the pandemic. So I want to highlight and want to thank you for your support. And there's nothing more that at this time, we have to do more, not less. So we do ask and for your support on this priority as we move forward in fiscal year 23. The second priority that we are focusing on is to prioritize investment in data collection and monitoring. And last year when I presented to the council, and I heard the echo, the need for that we have more data, and we should focus on data. And why? It's because Asian American community, we're not vocal. And a lot of time that the information is lost. There's a gap between the community need and the information that we have. So we need more effort to collect and monitor those data so that we can demonstrate the need and more effectively in allocating resources to support those needs. So let's work for in 2023. We would like to advocate and also collaborate with the department, HHS, and other partners that we have, so that we continue to collect that data that we need and improve our program. So you have in your hand is our fiscal year 2022 report with all activities, the outcome of the work that we have done. The two priorities I share with you today is not by any means diminish the two focus that we have in the past on mental health and senior health. That is in the past decade, AHI have focused on that. Right? The reason we transition because we want to demonstrate the ability for an organization, the county government office like AHI can transform because the need of the community change. So we need to adjust so that we can be effectively serve and connect with our community so that we be ready for the next pandemic whenever it happens and we be in a better position next time. Again, thank you for your support, and I'm looking forward to the discussion and answer any question that you have.
Thank you. We're flipping through this report. It's really impressive. Well, thank you both. Dr. DeVance Wilson, thank you for that testimony. I'm sure you heard yesterday, all of us were very excited to see the county executive's nomination of Dr. Keisha Davis as our new public health officer. I have had the opportunity to work with Dr. Davis in the past in different capacities and have been immensely impressed with her leadership in the community and nationally as well. And I think she's perfectly situated to help carry forward the great work of our public health team and the entire Department of Health and Human Services in collaboration or partnership. But I'd ask you, we will be interviewing her next week formally on the 15th, but are there questions that you would like for us to ask her? I know I'm putting you a little on the spot and you can follow up, but we would be happy to work through us, and I'm sure she will be very accessible during and after the interview process, but just any messages you would want to share.
Well, I am a little on the spot, but that's okay. I, too, and the Commission are all excited about the pending appointment of Dr. Davis. And yes, especially on the topic of environmental health, because this is something that we haven't pursued in the past. And I've been listening to everybody's testimonies and even your questions, and that is the one topic that I think is very little or getting very little attention, and certainly warrants a whole lot more. So I would be interested in her goals in relation to environmental health and raising awareness of environmental health hazards and threats, just everyday things that our residents have to contend with. We can do a lot if we know what the threats are and what the risks are, and so just more education in that area I think would be very helpful for residents. Another thing that just came to my mind, something that we don't like to talk about a lot, but just the disparities in STI rates is just really, I can't even express my concern fully for these numbers, especially in communities of color. I do hope that some effort is, or additional, because it's not like people aren't doing anything. People are doing things, but I would like us to be a little bit more creative about how we can address those kinds of issues in all communicable diseases. I mean, they're threats to us. We see that every single day. We still haven't escaped the problems of COVID. So, we live it all the time. So attention to those things are very important. We talked a little bit about public health administration as one of our priorities, and this is a little bit new for us as well. But in observing how we work together, even as commissions, but also government departments and working with policy makers, there is a need to be more collaborative, to be more transparent, to work together in a different way. And I was really proud of the Commission for bringing this up, because in business, they do it all the time and end up, being able to benefit from, like I said, the increased productivity and just in their bottom line. Of course, we're not in that kind of business, but certainly it becomes a win-win situation when we work closer together. This is my first time seeing Dr. Nguyen in person, and I mean, I'm very happy to see you, but it's just an example of how isolated we are, and I just hope that Dr. Davis thinks about those things, and I'm sure she will, and sees how we can do better in all of those areas.
Thank you very much, Dr. DeVans Wilson. Dr. Nguyen, thank you for your continued work. I think the work of AHI in particular is extraordinary in the way that you build bridges among our Asian community. And I was especially impressed with the process that you all set up to help facilitate the grants that went out to the various organizations. You showed a very high degree of expertise in both the manner in which you gathered information and the thoughtful approach that you all took. And I think that because you did such a great job, I think this next council should consider seeing how we can invest even more. We have our new Office of Grants that has been established, and of course the Department of Health and Human Services continues to do an outstanding job, but our Asian community in particular is one where we benefit from organizations that have the trust and both the language capacity but the cultural capacity to understand where communities are, because there are many nuances that county government is not in a position to be able to help address immediately. And so those bridges are particularly important. I'll just end with one last question. I know the mental health strain since the beginning of COVID, and as you noted in your testimony, continues to be an issue. You had the benefit of being here earlier when we heard from our mental health advisory committee, who is doing really great work. But if you could just elaborate a little bit more on some of the practices that you think we should be enacting to focus more on those mental health issues in our AHI community.
Sure. Thank you very much, Council President Albanos. Actually, I make a note for myself when I listen to the Mental Health Commission talk about their activities, because I really want to follow up with them. To build on the effort that was mentioned earlier, Dr. Wilson mentioned that how can we collaborate, how can we make our effort more concerted. For Asian American community, mental health has been always an hidden killer for us because we don't talk about it. And also the challenge that we encounter, similar to what was mentioned earlier. We have the lack, we don't have enough therapists, especially for mental health. The language barriers between the provider and the patient sometimes is the determinant factor. Mental health issue is really hard to address through a translator. So we really need to ensure that we have therapists in different languages, right? And how can we also, we have to really think hard on what would be appropriate approach for us to take next. In the past many years, AHI have approached it by creating resources and material. You have seen our photo novel, which is one of the educational material, and we translate it to multiple different languages, so that through the systemic and public health approach, we hope to address that issues and educate the community to build awareness. But I think now, as we move forward, we need to be more practical to see now, as people identify the problem, as people start going to seek help, how can we provide a frontline provider and them with the resource to understand the language, the culture of different community, so that they can deliver the service in a more effective way. So that's what I'm looking forward to explore further, and I make my note I mentioned. I will follow up to have that discussion.
Thank you very much. Council Vice President Glass.
Thank you very much. Thank you for the presentation. Already starting to pour through this. And Dr. DeVans Wilson, thank you for your comments as well. Two things I wanted to just pick up on through the conversation was the disparities that you spoke of regarding STIs. And I remember talking about this before the pandemic. And as we know, many of these inequities are across all diseases, all health disorders. It's societal, and that's what we're working to change. And we've found success in our models for COVID, and partnering and the community-based organizations, and that's what we need to do moving forward. And so I appreciate you elevating that and recognizing that a lot of that work also has to be done with our partners in MCPS and other youth organizations, because while you might have been speaking about adults, we know this is a problem in our schools, and particularly the schools with the highest amount of inequities that exist. So thank you for that. And then also, you had mentioned that one of the other priorities is environmental health. And I just wanted to learn a little bit more about how you are either interpreting that, or if that is an evolving topic that you're diving into.
Thank you, Councilmember Glass, for both of those questions. In terms of environmental health, we are starting to explore. We are aware of the many potential hazards that people are exposed to every single day, and just looking to the council, to the executive, to public health services to help us to get the information that we need to direct our course. Data, I don't need to say, is always a problem. I don't know if that's something Dr. Davis can work on, but I think it's global, and she won't be able to solve that by herself. But having data to identify areas where the air quality is poor, and just let people know, that these are certain risks. The employees who work in these different areas, being able to protect them with the equipment and PPE things that they need. That's something that's kind of like low-hanging fruit. Water quality is something else. I'm not saying that we have problems with our water, but being constantly vigilant about potential problems with our water, and preparing residents to be able to address any issues with water quality, and helping people be more educated consumers about the products that they buy, because a lot of our environmental hazards come in the things that we eat and drink and put on our bodies every day. So and pollution, obviously, our behaviors contribute to these problems. So I think that there's many opportunities for us to explore and advocate for. And right now, I just welcome the conversation from anybody, our other commissions, you guys, of course, and within our own body, so that we can identify something narrow that we can focus on. I think, just public education is the most important thing. And I think that, using the common contaminants, the exposures that people are most commonly exposed to, is a good start. I'm sorry. No, please go ahead. No, I was just going to go on to you made a comment about STIs and me referring to adults. Actually, it is our kids that I'm most concerned about, and that's why I think it's important to be vocal about this. I know it's not a subject that we like to talk about. I mean, who wants to? But the fact remains that the rates are it's astronomical. So, I do hope that we continue or start the conversation, or invigorate the conversation. I know that COVID has displaced a lot of our efforts in this area, but COVID is here. So let us just figure that out.
I appreciate you elaborating there, and I think the commonality between those two things is the conversation, as you just highlighted. And clearly, the health concerns among our students is mere fact that the conversations are not happening, or not happening robustly. And that is, there are national conversations about what conversations should be appropriate, clearly there needs to be more education and more intervention in some respects. And so we're simpatico on that. And then with the environmental aspect, I'm glad you're trying to figure this out, and I'm glad you're open to those conversations. There are no shortage of groups and organizations that are looking at environmental policy through racial justice lens and social equity. And you mentioned water, and as a member of the Transportation and Environment Committee just last week, we met with WSSC to talk about the rate structure. And it was front and center that we want to make sure that we don't run into problems with our drinking water, as has plagued so many other communities. So thank you again for elevating that, and more conversations clearly to be had.
Thank you for the questions.
Yeah, and Dr. Nguyen, thank you. I'll be brief. I don't have any questions, but I already looked through here, and what came to my attention was nearly more than 5,000 calls received, and 97% of the calls, the people were connected with county services. That's what this is all about, making sure that people who need help or don't know where to go receive the services. And then clearly, the other thing I wrote down from you was a quote: we have to do more, not less. And seeing what the need is, we have to keep doing more. And so as long as you continue providing us with the data to show that there is need and what people are needing in particular, we will continue doing our best to provide.
Thank you, Council Vice President Glass, and that's what we aim to do. So we will continue on our effort to collect the data and inform you and collaborate with you on the next step.
Fantastic.
Thank you for your support.
Thank you.
Thank you. Councilmember Rice.
Well, thank you very much, Council President, and I apologize for having to step out for a moment, but did just want to say, Dr. Vance Wilson, kudos for really focusing and centering on environmental health. It's something that since I got on this council, when we did elevated levels of, polycyclic aromatic hydrocarbons, I had no idea what that was. But now I do, and it was in coal tar. Coal tar is a sealant that we oftentimes put on driveways, and it's a less expensive way that they can actually make driveways and roads look better. But in other areas, they use higher, more expensive methods. And so when you look at the disparities that exist in terms of who uses coal tar versus who doesn't and where it's used, and the cheapness when you went to a Home Depot of which one a person would choose, and not realizing the health effects that go along with that. And it really is as simple as, we banned coal tar sealants, so did the District of Columbia, and Prince George's, becoming the first watershed in the nation to ban coal tar sealants, understanding the impact that it had on our waterways as well as on individuals who were applying them, who were also primarily people of color. And so it's these kinds of things where, again, we have to do more of the discussion. To carbon monoxide that I saw listed, that I also worked on this council in terms of making sure that we mandated carbon monoxide monitoring. And then most recently, radon and radon bill that's right before this council that hopefully we're going to move forward on. There's so much, as you listed, and so much more, right? But I do think that it is important for us to remember that in those spaces, outside of the typical ones where we talk about diabetes and hypertension and all kinds of other things, that, oh, and by the way, all these other environmental health concerns on top of it. That's the reason why we have the disparities that we do in our communities of color, right? And so it's really important. So I really want to thank you for lifting that up, and just wanted to put a finer point on that from my perspective and say amen to that, because it's incredibly important. And then, Dr. Nguyen, look, I remember from the very first time we spoke in my office, it was very clear to me that you and the other MHIs were laser focused on your mission of what it was that you needed to do. I remember the booklet that you guys made that was like the cartoon booklet about mental health. See, I remember all of these things. These are the things that, again, showcase how it is that you're innovating to reach the community and ensure that they have the information that they need. So it was no question in my mind that when you came to us and said, we need this money and it's going to go to a good purpose, I've seen the work. Over the 12 years that I've been on this council, I've seen the work that our MHIs have continued to do in continuing to reduce, we haven't eliminated them yet, but reduce disparities when it comes to access to health care. And so just wanted to say thank you. The data, as you heard from the Council Vice President and the Council President, is incredibly important to justify to those that don't know. And especially because we have new members that are coming onto this council, they'll need to be able to see things like this to understand what I already know, right? And for the community as well to already understand as well what it is that you guys have been working on. I did just want to say one thing and echo and double down on the sentiment around our kids and mental health. And I know that when it comes to our Montgomery County Public Schools, it continues to be a huge issue. Who knows where we're going to land when it comes to a lot of the decisions around higher education, academia, and admission standards. A lot of our magnet programs, all those things that we all know add pressure to our kids. And I know that our Asian American community in particular has a lot of pressure in those areas. We've talked about some of those things as well. And so I encourage you to continue working and pressing Montgomery County Public Schools. Montgomery County Public Schools, I know, is committed as well to making sure that we're doing more for mental health and support. Folks always think that it's just about, bullying or things like that, but it's also the internal pressures, right, that are the mental health things that we need to focus on as well. It's not always just those outside external pressures. And so keeping that conversation going, and I encourage you to have some conversations with the new health officer for Montgomery County Public Schools. That's a great way to keep this dialogue going and increase the outreach that you'll have in those communities. So, and I did just want to say one last thing. Sorry, Dr. Bridgers. I want to give a shout out to Dr. Bridgers, because when it comes to STIs, Dr. Bridgers and I were just on a call on October 10th with Let's Get Checked, talking about at-home test kits to go, because here's the thing, we already have test kits for COVID. People are used to testing themselves. They're used to doing these kinds of things. And so we've eliminated that part of the concern, uncomfortableness, stigma associated with testing yourself. So why aren't we testing for STIs as well, right? It's something, and so I really want to thank Dr. Bridgers and DHHS for their great work in working together. I ran into this person, it's funny, they always criticize us for going to conferences, but I found this person at a conference, and they said, look, I want to work with you, Montgomery County, you guys are doing great things. We heard about what you did with COVID. We want to work with you when it comes to STIs. And so we've got a great opportunity to do some great things. So just wanted to flag that for you as well, because you mentioned that.
We already have an exemplar. They used that in Howard County and had great success. So I'm happy that you brought that up, and thank Dr. Bridges and you for that. Hopefully we can get something done around it. Bye-bye.
Thank you for your comments, Councilmember Rice, and for your support for the past 12 years for the initiative. So I take the note from you and other council members seriously about the partnership with MCPS, because if we look forward to the future, those are our future. So thank you.
Thank you. And Dr. Nguyen, I did get your text yesterday about the question you asked, and I will be following up with you later today.
All right.
So thank you both so much.
Mm-hmm.
All right, we
Thank
move
you
on
all.
to our final two panelists. We start with our Alcohol and Other Drug Abuse Advisory Council. Laura Mitchell will be testifying, and then after that, we will hear from our African American Health Program, and Ms. Jackie Williams and Pat Grant will be testifying jointly together on behalf of AAHP. So with that, turn it over to Ms. Mitchell.
Good morning. Thank you. I'm happy to be here this morning, and I'm so glad to have all of you here who really care about the things that we're all working on, and we appreciate that. There is a common theme that I've heard this morning, and that is about families and the impact on families. Nothing happens just to one of us. It impacts all of us, our communities, our families, our schools, if that be the case. So I do appreciate that. With substance use disorder, it is inextricably linked to mental health disorders. And so I echo everything that Helga Luce shared, and probably a little more. One of the main things that we are working on this year and started on last year is stigma reduction. unfortunately, we've all had a global ACE or a global trauma with COVID for the last few years. Our children especially are feeling the impacts of that. And we know that if we don't treat the mental health conditions and the trauma that we have, we get greater mental health conditions, and we often have substance use that comes along with that through self-medicating or and other reasons for getting into that cycle. It can just take an injury when you already have trauma, and those two coupled together just kind of hijack the brain. So we really are trying to focus on making sure that everybody has access to mental health and substance use treatment. We're focused very much on the prevention as well. The treatment is really necessary for many people right now. And one of the things that gets in the way is stigma. We're talking a lot more about mental health, but we're still not talking enough about substance use and prevention and treatment for that and the root causes of it. So we're looking to work with Shatterproof and others to help reduce the stigma, do some evaluation of the level of stigma and some training in many, many settings, including our legal, our healthcare, our education settings, even within the county government and other government agencies. It's really important that when people do reach out, they aren't faced with a bigger barrier of stigma. In addition to that, the insurance piece of that coverage, making it affordable, making sure that Parity and Equity Act is enforced and that they can get to the care that they need and not have to choose between feeding their families or getting the help that they need. So that is critical as well. And one piece of that is for our youth. We've talked a lot about the youth this morning too. And we are looking to do a needs and gaps analysis for youth services for mental health and substance use treatment here in the county and in the region. We don't have enough, particularly if they need a higher level of care like residential. You really don't have enough. So, and there may not be enough need in either area, but combined, I think there are, and they're often, as I said, inextricably linked. So perhaps a P3 option, something like we did with Avery Road with a public-private partnership could be an option once we determine the actual need and can make recommendations on that. I don't have a cost for what that will be. I think we can utilize a lot of county services that already exist to help us do that without a tremendous amount of additional cost. The resource mapping is also very, very important in making sure that everybody has access to that. We have a number of agencies and places that these things exist, but I would suggest an app that people can reach those resources, determine what's available. Even if it's you need a bed for tonight, that you can get those resources right now. You can tell which place has a bed before you use your last $2 on the bus to get there and find out there's no space. So things like that, and allowing households to register within this app if they have a special needs person in their home, so that first responders, should they have to come there, would know what to expect if there's a person with autism or a person with Alzheimer's or anything that they need to know before they arrive. I think that would be critically important to better delivery of care in emergency situations. I mentioned that stigma reduction, and that is really critical. Our schools are the first place that we're looking for that to try to implement that. Continuing the Youth Ambassador Program with Ben Stevenson's group in the harm reduction and prevention, that is critical. We have to get to our youth. Right now, we are treating the symptoms. Let's get back upstream and deal with the prevention piece. And if we stop breaking people, we don't have to put them back together. So let's deal with whatever is doing that. And promoting screening for substance use and mental health in pre-adolescents and teens and pediatricians. The American Academy of Pediatrics recommends starting screening for these anxiety and mental health issues and substance use at age 9, and we're not doing that. The other thing is to encourage our physicians, working with the Physicians Network, to encourage them to prescribe naloxone with every opioid prescription that they dispense, and hopefully that's very few. The other issue that we have been working on for a few years now is Handle with Care, and that was rolled out last school year in one district, one police district, I believe it was 5. We are in the midst of developing an MOU between county agencies and MCPS and various police agencies. I don't believe that that is quite done yet, but that will make it countywide. What it doesn't include is the state police, so it would be great to try to wrap them into that. Handle with Care gets the first responders who have a school-age child at a scene that may be traumatic to report that, just that they were there, handle them with care. No private information is shared, just so that the school knows and that they can meet them with the trauma-informed care that they need. That's the other piece that we need to make sure is available, that when we identify a child who has experienced trauma, that we have the services to offer to them, including children in our schools who are 12 and older, making sure that they can access the care as per the law was intended, with or without parental consent. Sometimes it may be something that they are struggling with and their family is not as aware of mental health services or as open to them, but the child may feel that they need them. There are a myriad of issues why a child may need to speak with someone that can't, and our schools right now do not feel that in most cases they have the ability to treat anyone 12 plus without parental consent. So we have a lot of services we're putting into our schools, and I'm very concerned that those aren't being well utilized because of this barrier. So we are working with the Suicide Coalition to ask for an AG's opinion on whether or not they can offer those. Just a couple more things, really increasing the awareness and education in the public with parents and students and everyone that about the toxicity of edibles and the rainbow fentanyl that's out there, the Delta 8, all the new things. There's always something new. We need to keep up with that and make sure that we're doing public information campaigns even more and involving our students in helping to get those out. That's where that youth ambassador program can come in. Continued harm reduction and elevating peer recovery specialists, not just for the person in recovery, but the families. The families are key because they are the first line of support. And if they don't understand what's happening and they don't understand how to help their loved one, then it's going to be really difficult for that loved one to stay in recovery from any issue. We also want to support efforts to recruit a nurse practitioner or someone within our detention center so that people going into the detention center can be initiated on medication-assisted recovery. Right now, if they're on it when they come in, they can continue it, but we don't have the personnel there to initiate treatment. And that is sometimes the one break that they get, the window that we get of opportunity to help them with their, start them on the path to recovery from their substance use disorder. The other thing is I'd love to work with the businesses in our community to get more of the owners and the staff trained in delivering Narcan and have our EMS, when they respond to a call, be able to replace that right away, because you may not have days or weeks to get that replenished. So making sure that it's always on hand once they're trained and know that maybe some kind of an identifier on the door that says, that they have that, so that if someone is experiencing overdose nearby, that they can go in and get help from that business. That may be a big ask, but I think having it on hand, we can all encounter it at any time, anywhere. And I think it's critically important that we have Narcan, this life-saving medication, just like EpiPens, available at every opportunity in every AED device, and every bleed kit that we put out, we should be putting Narcan in it as well. So, and the last thing is supporting the Restoration Center. I think that is a really, really important opportunity, and that we need to embrace that. We had 107,622 deaths from overdoses last year, and we've had quite a few here in the county. We had 132 last year, 135, excuse me. But already this year, we have lost 5 youth to overdoses. We have to talk about this in our schools, as Councilmember Glass said. We have to talk about all of this everywhere at every opportunity, because it is a solvable problem, but we have to talk about it and we have to face it so that we can solve it. Thank you.
Thank you very much, Ms. Mitchell. And again, stay tuned. We're going to come back to questions and comments after our next panel, and that is our African American Health Program. I want to welcome Jackie Williams and Pat Grant, who are joining us virtually, and we thank them both. Jackie, I believe you're on mute.
You know, I'm not the techie one now. Thank you so much for the opportunity to speak with the council today. And I wanted to add one more thing today, that the African American Health Program's Executive Committee increased our numbers of members on the Executive Committee who are coming from really all walks of life in Montgomery County. And so we're just you'll see the names on our website very shortly. In terms of what we do, the African American program incorporates primary and secondary prevention strategies in its services. For primary prevention, we conduct health education and outreach. We ensure that clients have a primary care medical home. We offer a wide spectrum of screenings like blood pressure, body mass index, cholesterol, blood glucose, a hemoglobin A1C test, mental health, and we have a dedicated HIV person at Dennis Avenue who provides HIV screenings. In terms of secondary prevention, I'm going to try to go really fast here. We provide chronic disease management, which of course delays complications and premature deaths. We provide self-care and primary care management. And our staff is fantastic. We are staffed with diabetes educators, nutritionists, registered nurses, social workers, physical fitness trainers, community health workers. With the funding, AHP will continue our very high quality prevention services, and that includes our Kickstart to Health program, diabetes education programs, of course, healthy nutrition classes, exercise, yoga, physical fitness, the barbershop initiative, brother to brother individual support, which of course includes connecting our residents to rental assistance and food and mental health assistance as well. And we provide assistance to our pregnant women and infants through our SMILE program, which is our premier program. And we also provide, again, HIV screening and education. During the pandemic and now to present, our class sizes have really doubled in most cases. And but one of the things where we're most proud about is that we have helped pre-diabetic clients reverse their pre-diabetes status with our certified DPP program, our certified American Diabetes program, and our wraparound services. Very, very, very proud of that. And I can't say enough that is a huge. Our funds, of course, are used to implement our core programs, which are infant mortality, HIV, AIDS, STI, cardiovascular disease, diabetes, cancer, and oral health, of which the county's Black population faces the greatest disparities when compared to other populations in the county. In terms of our priorities and our concerns, we want to keep this momentum going by expanding our reach into the Black community. One of our initiatives is to expand AHP's reach to more Black pregnant women across the county through the SMILE program and its many projects, including our Mommy Chat and our breastfeeding classes and our maternal mortality activities. It's very key. Another initiative will develop opportunities for youth. We hear a lot about youth these days. Well, we're out there too. Provide opportunities for youth in Montgomery County to engage in healthy eating and lifestyles and promote the importance of self-care and prevention. promote their interest in medical, public health, and mental health and other health careers. That's yay, if you know my background. And also we want to enhance cancer prevention and early detection through our Cancer Ribbon Challenge projects, which include culturally competent materials and tools tailored to Black men, women, and our youth. We do need a more integrated digital marketing strategy, which will help AHP reach more residents that we serve in our community. You know, our residents that we serve, again, are African American, African descent, and Caribbean populations. We are frustrated that the situation with this, our lack of the ability to garner integrated marketing communications has hindered our ability to provide health education and self-care and primary care management information and resources throughout the county for our target population. And lastly, we are concerned that small businesses have to deal with challenge after challenge in order to work through the county's procurement process. I know no one's brought this up, but it's a perennial problem. It seems that every update to a budget requires a major rewrite and an amendment procedure, followed by delays each time there's a rewrite or amendment procedure. Problematic. Streamlining this procurement process would help all small businesses and perhaps attract more small businesses to Montgomery County. And finally, I'd like to encourage the application of racial and equity lens in all policies, specifically those policies that relate to health and social justice. Thank you.
Thank you. Ms. Grant, did you want to add anything?
No, I just want to say we do have an annual report that came out, which we'll get to you, to the county council, because in it, and I don't know if you all have gotten the annual report in the past. It is posted on our website, and it pretty much outlines the African American Health Program's accomplishment. And one thing, since there was a lot of emphasis on HIV today, I want to say that AHP, under the leadership of our dedicated HIV staff member, developed a sexual health for adolescents video in FY21. And they also developed a Kahoot trivia game to entice young people between the ages of 13 to 20 to learn about sexual health in a fun manner. So just to see some of the creative things that the AHP staff is doing, it's outlined in that annual report, and I'd like to get that to you all.
Thank you so much to both of you. So we'll open it up now for questions for both panelists, and I'll start just quickly once again. Ms. Mitchell, thank you for your testimony. I also want to thank you for, and everybody that once again helped to organize the candlelight vigil that was held in Veterans Plaza in the Executive Office Building just last month. It's always one of the most powerful events that I attend every year, and the images of loved ones in the courtyard who've been lost too soon is really powerful, and to have their families there on their behalf is extraordinary, and the courage that it takes to come forward is so important. And you could not be more right about the importance of eliminating the stigma and talking about this, as was mentioned earlier, in every forum we can, because 5 precious lives lost within our school system this year alone is 5 way too many, and just the pain that exhibits on all the family members is, I know, in many ways unbearable. So everything that we can do, and really, and this has been a theme overall of the last 2 days, and it has been the last few years, this cross-section, this collaboration among the various boards and commissions, I think is really important, because the interconnectivity, and you mentioned mental health, housing's another one in which, you know, these issues sort of rear their tragic heads. So really appreciate your testimony. And To our friends in the African American Health Program, I enjoyed having the opportunity to meet many of the new members of the executive committee in the council office building a few weeks ago. Was immensely impressed with the diverse resumes and perspectives and diverse geographic representation that was represented. So that, I think, bodes well for the African American Health Program, that you've been able to recruit such talented individuals who can help expand your all's reach. And under the leadership of Councilmember Rice, I really want to thank him publicly for his support of the African American Health Program and keeping it at the forefront. I know all of us will continue his legacy of investment in this important initiative, and Councilmember Jawando has also been really steady in helping to connect your all's work to what we are doing here on the council. And I personally commit to doing that, hopefully if I come back after November 8th, to continue to serve as chair of the Health and Human Services Committee and a partner to all of you. So I've been very impressed with the work that you have done, and I think, as I noted earlier, the appointment of Dr. Davis bodes well for all of us, and I think she's going to have a lot of meetings that she's going to have to participate in very soon, but I know she's already commented on the great work that you all are doing, and the Black Physicians Network in particular, and the potential to expand that and to really leverage it in a way that I think is going to make a huge impact. Last thing I'll mention regarding the African American Health Program, and this is true also of a number of our other boards and commissions, the area of telehealth and telemedicine I think presents some unique opportunities. The council recently enacted the possibility to enhance 5G technology across our county because we have to make sure that people have not just the technology itself in the way of computers or smartphones, but that they have the interconnectivity to be able to connect. And as we continue to struggle with staffing and recruitment among our medical providers, I think that's going to be at least one way, and it will never replace, nor should it, in-person care. But I think it's a strong enhancement, and I know our public health team has been really focused on this, and that's another area of potential growth. So more comments than questions there, but really appreciate both of the committees. And I'll turn it over to Council Vice President Glass this time. Council Vice President Glass.
Thank you, and thank you all for the really informative presentations, and I'm going to be really brief here. And Ms. Williams and Ms. Grant, your work speaks for itself. It has been at the forefront, not only during the pandemic, clearly preceding the pandemic, but over the last 2 years working hand in hand with the council, with HHS, with community organizations. I just want to say thank you. And as you have outlined, more work that needs to continue. The common theme here over today and yesterday has been continued communication and continued partnerships. And so I encourage you to continue doing what you're doing so that we can continue serving more people and more people who need help. So thank you. And Ms. Mitchell, you also highlighted, outlined a lot of different areas which need more support. And that is true, and I agree with nearly everything you said. And one thing in particular that stuck out, and I think it was a passing reference, and you had mentioned edibles, but where I'm going is that there is a ballot measure in Maryland to legalize recreational cannabis. And I think that we're going to have some conversations with you and your advisory council to figure out, how we allow that legalization to occur. And by all measures, I believe the voters of Maryland are going to move that forward, and how we allow that to happen and still allow our kids to be safe at home or at school or wherever it might be. And so I think that's one additional item on your plate. You alluded to it, but I'm putting a finer point on it. And over the next year or so, would love to continue that conversation. So thank you all three for joining us this morning.
Thank you.
Thank you.
Councilmember Rice.
It wasn't meant to be a passing reference. It is a major issue with edibles and children getting their hands on any of these substances. So I appreciate that, and I didn't mean for it to be a passing reference.
No, good. I was listening, so I just wanted to elevate it. Thank you.
I was trying to hurry through.
Well, thank you very much, Mr. President, and to my colleagues on the African American Health Program. I just as I said to our other minority health initiatives, do understand that the work that you've been doing, not just during COVID, but before, has continued to save people's lives. The reality is that all of us, especially in the Black community, that have seen family members die from preventable diseases, is just heart-wrenching. It really says a lot about what more we need to continue to do. It's different if it's a non-preventable disease or a non-treatable disease, but the reality is we lose way too many that are preventable and treatable. And so we've got to do a better job, and that is where you come in. And you know, it's interesting. You guys just had were just a panelist last week talking about fetal and infant mortality. I pay attention, so I see all the great work that you continue to do in the community all across the board with so many of your priorities. I will just say this: one of the things that we said earlier, and I agree with you in terms of that continued outreach to make sure that folks know about AHP and the great programs you have, is the mention of utilizing our alert system to be able to educate our community about the great programs that we have. And just a simple bit.ly line that says, you know, if you're concerned about any kinds of health issues and you're African American, African descent, please click here. And then it would forward you to the web page, and they'd be able to see all the great things that are there. And so, you know, we've been talking about that with all of our organizations. AODAC, the same thing applies for you as well. I think it's incredibly important for all of us, and it's a public service announcement in my perspective. So, but did want to ask you a question, because I know that this is one of the things that continues to be a challenge in our communities of color, and that is when we're looking at the heightened importance of health that came as a result of COVID. How do we continue that momentum in the community now that the pandemic is quote unquote over? You know, we really want to keep that momentum going, but how do you think it's best for us to motivate individuals to continue to care about their health in light of this, you know, us not being in this pandemic stage any longer? Pat or Jackie, either of you.
Thank you, Councilmember Rice, and thank you. I do want to say before this session is over, big thanks to you. We're going to miss you. We really are.
Thank you.
But thank you for all you've done over the 12 years, you said?
12
that
years.
You've been on the council. Yeah, it's wonderful. I think, you know, one of the things is we've learned something, we created something that works, right? So I don't think that should go unnoticed, and just keep that going, keep it funded, keep it going, because there are things that are put in place, new services, new ways to reach people, or enhanced ways to reach people. And I think the Asian American Health Initiative also mentioned trusted people. They know who in the community, you know, here are faces that and organizations that they can trust, that they know that it's going to look out for them, be a voice for them. And I think it also helps with the partnerships that we have created throughout the county. So I think if those things can be further just allowed to keep going, I think that's how we can, you know, get the what we need, like you said, to help to keep what we did well during COVID, is just to keep that going well.
Absolutely.
And what I mean by that, you know, you don't, you know, it wasn't broken. We need to just fund it and keep it, keep that particular mechanism able to function the way it did. And of course, process improvement. But I think that's it wasn't, you know, like they said, just keep that going. We found something that works, right? Just keep it going.
And I think so. That's the thing that I heard from the Asian American Health Initiative also was, look, we've set up a program that is now working. And you heard Councilman Vice President Glass say it and reiterate it. Then we need to continue to fund it because we saw the progress, we saw the success that's happened, and we need to double down on that to ensure that we're getting to more people. So I couldn't agree with you more. I did just want to highlight one last thing before I move to AODAC, and that is really about some of the heightened conversation around cancer and cancer screening and prevention, especially also in our communities of color. Something that, again, it's just very interesting how we laser focus on some things. We focus on hypertension and diabetes and other kinds of things and really don't talk about some of the others. And yesterday, when we were doing the presentation for breast cancer and talked about that, and you know, the outcomes when it comes to breast cancer go directly on ethnic lines in terms of seeing the disparities that exist in terms of survivability, right? That morbidity, it carries over. And so it really is one where we need to make sure that we're doing even more. So I'm happy that you highlighted that in terms of the cancer prevention, early detection. That's going to be incredibly important, understanding so many of the challenges that we continue to have. So really appreciate that. And then, Ms. Mitchell, when it comes to, you know, some of the priorities that you've listed, I think that, again, as you heard from Council Vice President Glass, it is going to be really important for us to start looking at now access for our kids, especially when it comes to drugs, vaping, when it comes to edibles, all kinds of things that are marketed specifically to our young people. And I really want to thank Council President Albornoz, who led the charge when it came to this council really tackling the vaping issue before it even got to the point where it is now. So thank you for your leadership and vision there in terms of understanding that. And it really is something where we have seen, and I know I've talked to Dr. Bridges about this and others, we have seen that fear of the transition from vaping back to smoking. It's happened. And so even though it's seen as a cleaner, it also is, you know, something where getting that nicotine fix and not having your device charged, and so you bum a cigarette off of someone because you know that it's still the nicotine that you're craving, and then all of a sudden, there it is. So, you know, we really need to make sure that we continue to do everything we can to try and stave off this kind of off-ramping for so many of our kids to utilize drugs. And as you said, Ms. Mitchell, I think the key is that treating why. They need to, you know, or feel the need to use the drugs to solve the problem, whatever they're experiencing. That's where we need to put our focus. I loved what you said about before they're broken and trying to fix them. Let's stop them from being broken. So, you know, I just really think there's a lot of effort. I know at the federal level there's a lot of effort and focus. This president has been very concerned about this as well. So hopefully we'll be able to draw down, and I'm looking at Dr. Bridgers, we'll be able to draw down some of those federal funds to help in this aspect. I do agree with you that having another Avery is an incredibly important step for us as well when it comes to behavioral health and drug treatment. Something akin to providing services in this county that gives treatment beds, that gives all of those things that we know are just so incredibly important to help to stabilize someone who is experiencing some sort of a breakdown or a challenge is incredibly important. So, you know, we've got to put our money where our mouth is and just stop saying that it's important to us, but, you know, we've got to make these things actually happen. So appreciate all of your, all of you in terms of all the great work that you've done. And I think that we're on the road to some great things happening here in Montgomery County. So thank you.
Thank you. Can I make one comment about the vaping?
Please.
We really are seeing some move from cigarettes to vaping, or from vaping to cigarettes. Mostly we see cigarettes to vaping because the vaping has at least twice as much nicotine in that vape cartridge as it's like smoking 2 packs of cigarettes. Okay, and all the other chemicals that are in there that we don't even know, from arsenic to other heavy metals. What we see more often is appears to be the move from vaping to other substances, because the vaping no longer soothes them enough, calms them, and makes them feel, quote, like normal looks. That is that escape, and when that no longer works, they move on. And for so long, we have not invested in prevention. So you can invest now or pay later. We didn't invest early on, so now we have to pay and invest in order to get ahead of that curve.
Thank you very much for that, Ms. Mitchell. I think that that's an incredibly important point that folks need to know as well. So yes, I wholeheartedly agree with you. So, Mr. President.
Absolutely. Well, thank you both for your incredible work, and please express our deepest appreciation by extension to the committees you all work with. This has been immensely helpful and informative, and we look forward to following up on a number of these items. And thank you, Ms. Yao. I know you've been taking copious notes. So with that, our Health and Human Services Committee session this morning is adjourned.
Thank you. And thank you, Council.